Hello everyone, today's video is another Q&A video. Today's topics are about using MSM, which is methylsulfonylmethane, for treating pandas, not the cute little animals, but the pediatric neurological condition, certain supplements to maybe combine or not combine with methylene blue, and what was the last one? Oh, and then treating bladder biofilms. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. Also, I'm still in my casual wear because I'm still working from home, still have a family member in the hospital, and hence the lo-fi video, but better lo-fi than no-fi, I suppose. So the first question here is, can MSM help with pandas? Currently using low-dose immunotherapy, which is amazing. One of the best therapies for pandas in my experience, so great to hear that. But interested in adding other things for my daughter that may help after 8 years of this horrible illness. Yeah, so I'm sorry to hear that your daughter's been suffering for so long. I really hope that she's doing better ASAP. So really great question. I think on paper, yeah, it makes all the sense in the world. I've been so excited about MSM, also known as high-dose sulfur therapy, for the last several months. I've been using it with lots and lots and lots of patients, using it myself. The thing with MSM is that it's really, really gross. It's very, very, I should say, it's very, very bitter. Maybe some people like bitter, so I don't mean to be judgy about the bitter, but it is very, very bitter. So I've played around with it with my kids a little bit, and I've been able to get a gram, like 1,000 milligrams into them fairly easily, mixing it with, I think we just put it in juice, mixed it with some of their other supplements, and it went down pretty well. But just to get a good therapeutic dose, I just don't know if it would be, it could be quite challenging to get a high enough therapeutic dose into a child if they can't swallow pills. Now, if they can swallow pills, it could still be a challenge potentially because each MSM pill, you can only ever get 1,000 milligrams per capsule at most, and the therapeutic dose, depending on the child's age, like, I mean, just doing the approximate math, like even if a child has been suffering for this for 8 years, and if they maybe were afflicted as young as maybe 3 years old, it's like, okay, they can maybe swallow pills at 11-ish, give or take, but the therapeutic dose could require like swallowing like a handful of MSM pills, depending on the therapeutic dose that they need. So I don't know is what it comes down to. I haven't used it in pandas. On paper, it makes all the sense in the world. That being said, I find that with pandas, we really want this anti-inflammatory angle of treatment, and we want an immunomodulating angle with treatment. And MSM can potentially fill both of those niches, shall we say, but there are other supplements that seem to be quite reliable in my experience that can really help with that, such as quercetin, such as glutathione. I've been using more and more molecular hydrogen with patients over the last year plus or so, and that's really easy to get down the hatch because it doesn't taste like any, well, depending on whether you're using hydrogen water generator or you're using molecular like tablets that create molecular hydrogen in the water, there can be a bit of a sour taste. There's a bit of a sour taste with the tablets, but really easy to hide that in my experience. Chinese skullcap, fish oil, SPMs, like various things like that. So I guess I haven't really felt that I've been missing, like I haven't really felt the need to like really try to push the MSM in my pandas patients because of the logistical challenges, and I don't really feel like we've needed that angle per se, but on paper it would make all the sense in the world to try that, in my opinion. Not that I'm giving advice for your particular daughter, but just theoretically it would make all the sense in the world that kids with pandas would potentially really benefit from that. So thank you for the question. Very good, thought-provoking question. Next question here is on, all right, about methylene blue. So as I mentioned in a few other videos, I have this one like really popular video. It's my only really popular video. We're up to 45,000 views, 400 comments. So thank you to everyone who has commented on and viewed my methylene blue video. It's called Don't Take This While Taking Methylene Blue, which I think I posted it, by golly, a year ago. I don't really remember what I even said in the video, but I believe it was just talking about like avoiding things that boost up serotonin in the body, is that there can be a potential contraindication there because methylene blue can liberate serotonin as well through its monoamine oxidase inhibition activity. But then this video has taken on a life of its own, and just there's endless questions about like, can I take this? Can I take this? Which dose should I take? And as anyone who watches my videos knows, I don't give dosing advice because I'm not allowed to, and it's just really not the most responsible thing to give advice over social media, not knowing a person's individual case. So long and short of it is somebody did post this very succinct question, so I thought I'd answer this one. So it says, how about methylene blue together with Lugol's iodine or with creatine? So thank you for the question. And yeah, so with methylene blue, I combine methylene blue with lots and lots of different things. The only things that I'm really cautious around are things that are going to potentially boost up serotonin. Now, to my understanding, there's probably actually a fair bit of wiggle room with oral methylene blue and things that boost up serotonin. The research literature showing that serotonin syndrome is a potential issue with methylene blue, to my understanding, has to do with, based on the research literature, looking at really rapid intravenous infusions of methylene blue to treat methemoglobinemia, which is this really rare condition that they treat in hospitals. People get really sick, usually due to a drug reaction, sometimes from other reasons. So I don't think that it's something we have to be like super, super, super scared and cautious with, but we still want to be cautious and responsible and all that. But when it comes to something like Lugol's iodine with creatine, again, I'm not giving any advice here, but I can't think of any reason why it wouldn't be okay to use methylene blue with those things. So putting it another way, I've taken methylene blue on occasion, and if I happen to be, and I have taken iodine, Lugol's iodine in the past, I've taken some creatine in the past, I would personally have no issue taking those together myself. So I'm not aware of any reason that would not be okay to combine those together. I've combined methylene blue with my mitochondrial support formula that I've made many videos about before, which is like high doses of different B vitamins and minerals and amino acids and antioxidants. It plays very nicely with that clinically. There's no I've not seen any issues combining them clinically, and I am not aware of any contraindications on paper that we have to be worried about there. I've combined it with different intravenous therapies like ozone, typically not on the same day because methylene blue, at least at lower doses, is an antioxidant. We don't want to combine that with a pro-oxidant, but sort of in the same treatment protocol, they could be combined. There's no harm. They just might kind of neutralize each other if they were too close. It combines well with lots and lots of different things. Sometimes folks are posting questions about what about this drug? What about my bipolar medication? It's like, I don't know. I mean, I don't specialize in bipolar, so I'm not sure. So if I don't answer the questions, it's because I don't know. Anyways, I'll leave it there. So yes, I'll leave it there. Thank you again for all the love on the methylene blue video. Last question here, another fairly popular video actually, 4,000 views on that one, which for me is really darn good. So the video is, why do some biofilm disruptors not work? Well, 104 comments on this one. So anyways, it says, I've had the same UTI for 12 years. What would be the best biofilm disruptors for me? I've tried D-mannose and am now taking oregano, thyme, clove, vitamin C, and Chinese herbs, feeling pretty desperate. I'm just reading about lactoferrin. My GP, 2 urologists, and my ND have not been much help. Can you please list the phase 2 biofilm disruptors? So yeah, sorry to hear about the extended extended symptoms that you've been experiencing. Yeah, and of course, you're saying what are the best biofilm disruptors for you? I don't know. You have to talk to your healthcare provider about that. But in terms of listing the phase 2 biofilm disruptors, I will just say that for chronic embedded UTIs, or CUTIs as they're sometimes called, things that I think about in my practice, there's this lab called MicroGen DX, just micro like microscopic, gen like generation, GEN, and then DX like short form for diagnosis. I think it's probably .com if I had to hazard a guess. They do really extensive testing that can give us good insight into the underlying cause of chronic embedded UTIs. They do sensitivity testing for antibiotics as well. So just to say that that's a resource that I recommend for some of my patients. Quite expensive, unfortunately, but it is a resource that's out there. And then my preference for most of my patients is to use silver hydrosol as a phase 2 biofilm disruptor for chronic embedded UTIs because we know that a lot of it is excreted through the kidneys. So what goes through the kidneys is going to go through the bladder. And silver is a really good phase 2 biofilm disruptor. Other phase 2 biofilm disruptors are every chelating agent. So DMSA, EDTA, DMPS, bismuth, R plus alpha lipoic dithiol complex. And those are really the strongest ones, but silver is my go-to with the bladder cases. I hope this was helpful. Any other questions, just post in the comment section below. I'll do my best to answer as soon as I can.